Hello everyone and welcome back to the third part of dermatology review questions. In this section we are going to speak about atopic dermatitis. What is the primary mechanism of action of tacrolimus or tacrolimus when used for atopic dermatitis? So here we ask about the mechanism of action of tacrolimus. Number one, inhibit T cell activation. B, inhibit keratinocyte. C, increase synthesis of folic acid. Or D, promotion of collagen production. Okay, tacrolimus or tacrolimus. Okay, tacrolimus belong to the topical calcineurin inhibitors. We have tacrolimus here. We have another medication belong to the same group called bimecrolimus, considered like immunomodulator. As you can see here, calcineurin inhibitor tacrolimus inhibit activation of T cells and mast cells. Okay, so according to this slide, the mechanism of action of tacrolimus or tacrolimus will be inhibition of T cell activation. But the first step for the tacrolimus for working as tacrolimus will be inhibit calcineurin. This is the first step. The second step will be inhibit activation of T cells. Moving to the next question. Patient on long-term systemic corticosteroid therapy for eczema is at risk for which complication? So you place the patient on systemic cortisone. What is the risk of this complication? Adrenal suppression, bone marrow suppression, anemia, hypoglycemia. Which one is correct? Long-term side effect of glucocorticoids from this list here. As you can see here, potential systemic side effect will be suppression of hypothalamus pituitary adrenal gland. So the result will be adrenal suppression. So the long-term complication of treatment with the systemic cortisol will be adrenal suppression or hypothalamic pituitary adrenal HPA axis suppression. Next, which therapy is considered first line for atopic dermatitis in children? First line treatment for the atopic dermatitis in children. We have topical corticosteroid, UVB phototherapy, systemic cyclosporin, or calcineurin inhibitor. Which one? First line therapy according to the references, textbook, and slide lectures. You can see here topical corticosteroid to consider like first line therapy for atopic dermatitis. The alternative will be calcineurin inhibitor, and the second line will be phototherapy. So the first line therapy for the atopic dermatitis will be topical corticosteroid. Moving to the next question. Which of the following treatment is approved for use in children as young as 3 months of atopic dermatitis? Dupilumab, Dupixent, abrocitinib, Cibinco, or carrizoborol, Eucresa, or tacrolimus, Brotopic. Okay, we're looking for the medication we can prescribe to the children as young as 3 months for atopic dermatitis. Okay, you can see here the Eucresa as ointment maybe is prescribed to the children about 3 months age. Okay, Eucresa, carrizoborol. Okay, Eucresa, 3 months of age. Okay, again, the question here. So the question here, another question, what is the primary mechanism of action of Eucresa? As you can see, Eucresa inhibit phosphodiesterase 4 enzyme activity. So the correct answer will be inhibit phosphodiesterase. Again, to repeat the information, Eucresa is a medication worked by inhibit the enzyme called phosphodiesterase 4. Okay, and this medication used for atopic dermatitis, Eucrisa. Okay, next question. What is the mechanism of action of dupilumab, Dupixent in treating atopic dermatitis? How this medication work? Dupilumab or Dupixent inhibit phosphodiesterase, black interleukin, increase mast cell degranulation, or enhance C or T cell activation. Okay, what is the mechanism of action of Dupixent in treatment of atopic dermatitis? As you can see here, Dupixent mechanism of action work by blocking interleukin 4, interleukin 13. So the correct answer will be B. Dupixent block interleukin 4, interleukin 13, decreasing inflammatory cytokine. So the correct answer will be B. Dupixent block interleukin 4, interleukin 13. Okay. Next, we have which of the following is a potential adverse effect? Which of the following is a potential adverse reaction associated with the ubitasitinib, Rinvoq, and abrocitinib, Cibinco? Increased risk of malignancy and serious infection, hypersensitivity reaction to topical application, elevated liver enzyme, or injection site reaction. Okay, first of all, we need to look on answer maybe letter D, injection site reaction. This is not correct because this medication, Rinvoq and Cibinco, is oral medication, not injectable medication. This is not correct. Okay. Rinvoq and Cibinco, ubitasitinib and abrocitinib belong to the JAK inhibitor. The side effect will be infection, malignancy, thrombosis. As you can see here, the correct answer will be Cibinco and Rinvoq increase risk of malignancy and serious infection. Okay, next question. Which of the following is a first-line therapy for atopic dermatitis? Tacrolimus, phototherapy, topical cortisone, or dupilumab, Dupixent? What is the first-line therapy for atopic dermatitis? Tacrolimus, phototherapy, topical cortisone, Dupixent? As you can see here, for the atopic dermatitis, the first-line therapy, drug of choice, topical cortisone, TCS, topical cortisone. Okay, which age group is approved for treatment of which age group is approved for treatment with calcineurin inhibitor, like tacrolimus and bacrolimus? Infant older than 3 months, children over 2 years of age, or adolescents or adult only? What age is appropriate for treatment with the calcineurin inhibitor? And remember, these two medication available as topical medication: tacrolimus, Protopic, and we have bacrolimus, Elidel. Moving to the slide to show you what we have here: adult and children older than 2 years. So the correct answer will be children over 2 years. So tacrolimus, calcineurin inhibitor used for patient 2 years and above. What is the primary use of Dupixent? Okay, what is the primary use of Dupixent in the treatment of atopic dermatitis? The primary use. Dupixent, the first-line treatment for atopic dermatitis, first-line treatment for all cases with the atopic dermatitis, Second line treatment of all cases with the age 12 years and above. Treatment of atopic dermatitis, or we can use it for prophylactic treatment. Dobexant, Dobilumab, you can see it here. We use it for maybe patient 12 years and older, suffer from atopic dermatitis. Okay, second line treatment. So the correct answer for Dobexant, Dobilumab, Dobilumab, Dobexant, consider like second line treatment for patients from atopic dermatitis at age 12 and above, at age 12 years and above. Okay, this will conclude our review question regarding the treatment, drug therapy of atopic dermatitis. Thank you so much for your time and have a great day.